welcome. My name is Dr. Betty Jordan. I am a perinatal clinical nurse specialist and an assistant professor from Johns Hopkins University School of Nursing. I also serve as an elected member of the Board of Directors for the Association of Women's Health, Obstetrics, and Neonatal Nursing. I maintain a clinical practice working with Baltimore City Health Department, reviewing infant and neonatal deaths and aspects of prenatal care of women in the community. Every day I see the consequences of the failure of women to obtain optimal nutrition in pregnancy. So I'm excited to be here today as a representative of the National Healthy Mothers, Healthy Babies Coalition for the presentation of these very important recommendations. Today, the Maternal Nutrition Group joins us to help educate doctors, midwives, and other health professionals, including my fellow nurses and women of childbearing, about the importance of fish consumption in maternal nutrition.
Thanks, Betsy. Yesterday in clinic at Los Angeles County Hospital, I met a young patient, a Latina patient, and she told me first thing that I eat fish in Spanish. And to make sure that she understood, I understood that she was interested in the development of optimizing the development of her own child to increase brain development and decrease preterm birth. And we'll talk about other advantages from optimizing food in pregnancy and breastfeeding. I think the preponderance of the evidence now suggests if you don't get ocean fish during pregnancy, this is like a deficiency. If you're not eating fish, then you have evidence of absence of that metabolically in our bodies in terms of both babies and women.
The aspect of nutrition that brings us here today is the topic really of omega-3, long-chain omega-3 fatty acids and the impact that they can have on pregnancy outcome. The aspect of this nutritional issue and our concern that brings us here today comes from what we feel are adverse effects from the EPA advisory regarding fish consumption. Without a doubt, the intent of the FDA advisory was a good intention, which is to try to avoid the theoretical risks of maternal harm or fetal harm from exposure to trace amounts of methylmercury that is present in these ocean fish. However, the unintended consequence of that has been really a major public health issue, which is the reduction of seafood consumption by a large number of obstetrical patients to a point at which they are receiving insufficient omega-3 long-chain fatty acids.
Good morning. In the United States, obesity is in epidemic proportions, and making diet once again the primary therapy and the primary cause of obesity. A diet that's nutrient dense, foods that are minimally processed, foods that are of a low glycemic index are actually extremely beneficial, not only in preventing the complications of obesity, but in a woman who is obese and is pregnant. This is often a challenge because you don't want overnutrition of the woman and undernutrition of the fetus. Now, there are a number of foods that are very nutrient dense and that are a good economic buy, and fish is exactly one of those foods. It is one of the most nutrient dense foods you can eat, and it uniquely contains one of the highest levels of the omega-3 fatty acids, which we know is critically important for brain development, vision, cognitive development, and what we are learning, it may also affect preterm labor, which has been rising in preterm birth and rising in the United States in recent years, as well as postpartum depression. Fish is a really critical component of the prenatal diet, the preconception diet, the postpartum and breastfeeding diet. It's a good economic buy, and it is a uniquely rich source of the omega-3 fatty acids.
Thank you for the opportunity to be here today. February of this year, a study was published in The Lancet on diets of more than 11,000 women and the development of their children. This study confirmed that women who eat fish will be exposed to a trace amount of mercury. However, it demonstrated that the baby gets real benefits from its mother's eating more fish. The benefits of eating fish in this study outweighed any effects that mercury had on the growing nervous system. This study reports that the children of women with the highest fish consumption also had the best outcomes on measures of the developing brain and nervous system in their children. It's important for public health programs to encourage women to eat fish during pregnancy or to find other ways to get DHA into their diet through supplements.
We conducted a survey at the Medical University of South Carolina in Charleston, South Carolina. The goal was to determine the degree of awareness of fish consumption advisories and determine the amount of fish consumption in reproductive age women. Our survey demonstrated a high level of fish consumption advisory awareness in pregnant women, with 56% of pregnant women aware of the fish consumption advisories. Pregnant women were 2.9 times more likely than non-pregnant women to be aware of the advisories, a statistically significant difference, with 37.6% of non-pregnant women reporting they were aware of the advisories. We found that the women in the survey had overall low levels of fish consumption. In pregnant women, 29% did not consume any fish, while 67% ate fish less than twice a week. Less than 3% met or exceeded the current consumption advisory guidelines. In addition, we found that knowledge of the advisory resulted in 56% of pregnant women reducing the amount of fish consumption to levels lower than prior to their pregnancy. 42.7% did not change their consumption during the pregnancy. As a way to validate our sample at the national level, we worked with the National Healthy Mothers, Healthy Babies Coalition to poll women pregnant for the first time. The same questions from the MUSC survey were used. The national survey had similar results. 53% of women reduced their fish consumption during pregnancy because of awareness of fish advisories. This data supports the importance of the recommendations of the Maternal Nutrition Group, reminding women that the FDA did not advise them to stop eating fish, and stresses the need for improved education on the benefits and safety of appropriate fish consumption during pregnancy.
Thank you, Betty. As a physician, a researcher, and a mother of a 16-month-old child, I understand the confusion women face when confronted by this issue, the issue of how much fish is safe to eat in pregnancy. I understand the concerns about mercury in fish, and that was the goal of our meeting, to sort through the scientific evidence and come up with a consensus about fish consumption in pregnancy. I am convinced that the benefits of eating fish in pregnancy outweigh any potential risks. In fact, I chose to eat 2 to 3 servings of fish a week during my pregnancy. For women who can't or won't eat fish during pregnancy, fish oil supplements are a reasonable option as they do contain long-chain omega-3 fatty acids. Our group understands that pregnant women are concerned about eating fish, but we hope that our science-based recommendations will give women who are pregnant, nursing, or planning to become pregnant the confidence that they are doing the right thing for their health and the health of their children by including a minimum of 12 ounces of ocean fish per week in their diets.